From Zoom meetings to virtual conferences, this pandemic has changed how we do so many things. And for Ohioans with disabilities, that includes how the facilities they live in are monitored. News 5's Olivia Fecto tells us one disability rights organization has had to make adjustments to make sure it can still protect the people it serves.
The reality, even though I hate it, is that people with disabilities of all kinds are a very vulnerable population.
Susan Culler lives in a long-term care facility in the Cincinnati area.
It specializes in people with neurological deficits like I have cerebral palsy.
At 38 years old, she's too young for a nursing home, but that's what her facility is considered during the pandemic. That means no visitors.
It's been kind of isolating, so I appreciate DO doing as much as they can to relieve the isolation.
DRO, or Disability Rights Ohio, is a nonprofit that works to protect and advocate for Ohioans with disabilities. Staff can legally go into a variety of facilities unaccompanied.
We go into nursing homes, we go into residential treatment facilities for youth, and mental health residential treatment facilities for adults, and jails and prisons.
Part of what they do is monitoring, touring facilities, looking at conditions and possible safety issues, and talking to residents.
Not so much for me, but imagine the people who can't talk, who can't speak, who can't articulate. They need someone to be their ally.
Even if we weren't feeling sick, we recognized that we could in fact spread COVID-19 into those facilities if we continue to go in.
During the pandemic, DRO had to switch to remote monitoring, conducting virtual tours and speaking with residents privately by video call. Andrea Bucci is the CEO of Heartland Behavioral Health Care, one of 6 regional psychiatric hospitals in Ohio. She says monitoring is good for patients, too.
Knowing that there's an agency looking out for them and protecting their rights wholeheartedly is supportive to their recovery process.
While there were some challenges, including fewer chances to speak with residents, DRO says without travel time, advocates can be more efficient. From October 1st through the beginning of March, DRO visited 18 facilities. From April through mid-June, 86.
Obviously, we'd all be happy to get back to normal, but you got to do what you can in these weird times. Any monitoring is better than none.
Olivia Fecto, News 5.